Recently, we've discussed regenerative medicine with Dr. Todd Muncy from Muncy Family Chiropractic and Sports Health Center. And this morning, we continue that discussion with a more in-depth look at regenerative medicine. Good morning, doctor.
Good morning, and thank you for having me this morning. Sorry I missed last week.
Oh.
Yeah, it came up, and I wasn't able to be here, but I'm so excited to be here today.
All right, very good. And let's jump right into it. Let's talk about regenerative medicine. Kind of give us a background on what regenerative medicine is all about.
Well, regenerative medicine is, medicine it's an area of healthcare that has the potential to have a disruptive effect on the way we, look at certain human conditions and ailments. Allogenic human cells and tissues and products are able to supplement the body's ability to heal itself.
And why would somebody show an interest in regenerative medicine? Why should they think about regenerative medicine?
Well, there's several reasons, but, one of the biggest that we find is older people that have joints that are going bad, because the human body utilizes, a variety of cells and interactions to support the healing process. But as we get older, we get longer healing times, increased inflammation, changing chemical environment inside our body, and cell exhaustion. So our body doesn't heal quite the way it used to. And so people in that age or older age category tend to want to look at it. Also, you look at younger people who have damaged tissues in their body, athletes, things like that, because, regenerative medicine's broke up into three interlocking categories, really. It's rejuvenation, where, we use certain cellular structures to help the body rejuvenate. Even tissue once thought not to be able to regenerate itself shows signs of being able to regenerate, like nerve tissue and things like that, with regenerative medicine. And then you have replacement, and replacement is where we replace the old cells with new cells and help the body start to develop a healthy, joint space or something of that nature. And then there is the regeneration. The regeneration is when we, put the cellular matrix inside the body, inside the area of complaint, and the body starts to regenerate what used to be old and now is good. Even tissue that's been torn or disrupted severely can regenerate itself.
What happens if someone, you give them that injection, you give them that regenerative medicine treatment? What happens to the body when you do that?
Well, first thing that happens is the body recognizes what's going on. There's a cellular structure in there, and it starts to take over and develop that new cellular structure framework at the point where we injected it. And it starts to, create new cells that are the same as the cells in the area that we're injecting it into. But after that, there's this thing we have to do. It's not just inject and forget, because the body has to have some more help with that. So we have a rehab program as well that we utilize after the injection to help these people get stronger, develop, a nice healthy joint structure again, and keep moving.
What are some of the injuries and ailments that would be good candidates for regenerative medicine?
Well, burns, there's a good one, but, in our office, we're not doing that, but there are companies that are dealing with burns, but we deal more with spinal trauma, knee traumas, shoulder traumas, degeneration of certain organs and things of that nature. Athletes, get hurt and want to heal faster, don't want to have surgery, or someone who has, just a joint that is going bad and have been told that, you're just going to need surgery in the future. Right now, we're just pacifying it until you need surgery. We no longer have to just pacify it until we need surgery. Regenerative medicine shows, the future of healthcare, where we can start to regenerate joints and not wait for them to go bad and need surgery.
Let's talk about age. Is there any kind of age limitation on this?
Absolutely not. It's called quality of life. It doesn't matter how old you are. It really boils down to quality of life and how you decide you want to live your life. You could be 80 years old and your knee is starting to degenerate and things like that. And if you can't go up and down steps and you can't get around the way you want to, is that important? To most, they'd say absolutely. And, to a young athlete or to a young person who can't play the sport they love anymore, would it be, an option? Absolutely. Or just to the general person who goes out and gets chronic injury after injury after injury at work, would it be something to benefit them? Yes, yes, it would. And that's who we target. We're not discriminate in who we want to bring this to. We want to bring it to the entire population to help as many people as we can.
And if someone comes into your office, they give you a call, what is the process that you get them through to get to where regenerative medicine may be the answer for them?
Well, we do a complete physical exam on this patient. We go through it with us, our nurse practitioner, because there's 2 doctors in the office, our nurse practitioner and our staff. We sit down and go through, their x-rays, their other doctor's reports, and any information that they can bring us. After that physical exam, we sit down and have a meeting about what is best for this patient. We discuss, is regenerative medicine right for this patient or is it not? And then we present that report of findings to the patient to give them the best idea of what care is going to best suit them at that time.
All right. Dr. Todd Muncy, thank you so much. A very interesting subject. We appreciate your take on everything.
I appreciate being here. Thank you so much.
All right, Dr. Todd Muncy there. Folks, we got some information we want to pass along. It is Muncy Family Chiropractic and Sports Health Center. There's the number. If you feel like regenerative medicine can help you, give them a call. Check out that website right there at the bottom of the screen as well.
The preceding portion of Daytime Tri-Cities was sponsored by